If you are over the age of 60, or if you love someone who is, I need you to stop everything you are doing right now and pay very close attention to what I am about to share with you, because this information could literally save a life. What I am going to talk about today is one of the most overlooked, most misunderstood, and frankly one of the most dangerous health crises quietly unfolding inside millions of homes across the world right now. And the frightening part is that it is not being caused by a virus. It is not being caused by genetics, and it is not something anyone planned. It is being caused by the very medications that doctors are prescribing every single day. Medications that are sitting in bathroom cabinets and kitchen drawers in almost every household where a senior lives. Medications that are considered normal, common, and even necessary. But here is what most people are never told. Some of these medications, when taken by older adults, can cause symptoms that look exactly like Alzheimer's disease. Confusion, memory loss, disorientation, personality changes, inability to recognize loved ones. And because doctors and families assume it is just aging, the real cause is never investigated, the medication is never stopped, and the person continues to decline. Today we are going to change that. We are going to name names. We are going to talk about 9 categories of popular medications that have been scientifically linked to rapid cognitive decline and dementia-like symptoms in seniors. We are going to explain exactly what these drugs do to the aging brain, why older adults are so much more vulnerable than younger people, and what you or your loved one can do right now to protect yourself. This is not about scaring you away from all medication. This is about making sure you have the information that your doctor may not have had the time, or, in some cases, even the training to give you. Because when it comes to your brain, you deserve to know the full truth. Let us start by understanding why older adults are so uniquely vulnerable to medication-induced brain damage. The aging brain is not the same organ it was at 30 or 40 years old. By the time a person reaches their 60s and 70s, the brain has already undergone significant changes. The blood-brain barrier, which is the protective filter that keeps harmful substances from reaching the brain, becomes more permeable with age. This means that drugs which once stayed largely in the bloodstream can now pass more freely into brain tissue. At the same time, the liver and kidneys, which are responsible for metabolizing and clearing drugs from the body, slow down significantly with age. A drug that a 50-year-old might process and eliminate within hours can linger in a 75-year-old's system for days. This creates something called drug accumulation, where the medication builds up to toxic levels in the body, even when taken exactly as prescribed. Add to this the fact that most seniors are taking not just one medication, but an average of 5, 6, or even more prescriptions simultaneously, and you have a perfect storm for what researchers call polypharmacy toxicity. The drugs interact with each other in ways that were never tested, because most clinical drug trials are conducted on younger, healthier adults, not on the population that actually uses these medications the most. There is also the issue of neurotransmitter sensitivity. As we age, our brains produce less of the critical chemical messengers that regulate memory, attention, and cognition. Acetylcholine, dopamine, serotonin. These chemicals decline naturally over time. Certain medications interfere with these systems so aggressively that in a younger brain, the effect might be subtle, but in an aging brain already running on reduced reserves, the impact can be catastrophic. A person can go from sharp and independent to confused and helpless in a matter of weeks, and everyone assumes it is Alzheimer's, when in reality it is a pill they swallowed that morning. This condition even has a name in the medical world. It is called drug-induced cognitive impairment, and a related and especially severe form is called anticholinergic cognitive burden. Research published in some of the most respected medical journals in the world, including JAMA Internal Medicine and the British Medical Journal, has confirmed that certain classes of drugs dramatically increase the risk of dementia, and that stopping those drugs can sometimes reverse the cognitive damage, particularly if caught early enough. Let that sink in. What looks like dementia may not be dementia at all. It may be a side effect, and it may be reversible, but only if someone knows to look for it. So let us look at the 9 medications that every senior and every family member of a senior needs to know about. The first category is sleep medications, particularly the class known as benzodiazepines and the so-called Z drugs. These include medications with names like diazepam, lorazepam, temazepam, alprazolam, and the Z drugs like zolpidem, which you may know by the brand name Ambien, and zopiclone. These drugs are extraordinarily commonly prescribed to older adults because sleep problems are extremely common in aging, and these medications do work in the short term. They quiet the nervous system, they induce sedation, and they help people fall asleep. But what happens inside the brain during that process is deeply troubling when it occurs night after night in an older person. Benzodiazepines work by enhancing a brain chemical called GABA, which is an inhibitory neurotransmitter. In essence, they suppress brain activity. The problem is that the brain is not meant to be chemically suppressed repeatedly over long periods of time. In older adults, prolonged use has been shown to cause what researchers describe as structural brain changes, including shrinkage of the hippocampus, which is the region of the brain most critical for forming new memories. Studies have found that seniors who use benzodiazepines long-term have a 50% higher risk of developing dementia than those who do not. Even more alarming is that these medications can cause acute episodes of confusion, memory blackouts, and disorientation that are so severe they are mistaken for the onset of Alzheimer's. And because doctors often assume elderly patients sleep poorly because of cognitive decline, the drug is continued rather than questioned. If your loved one is on a sleep medication and has started showing signs of memory problems, this must be discussed with a doctor immediately. The second category is antihistamines, and this one surprises most people because many of these medications are available over the counter without a prescription. Drugs like diphenhydramine, which is the active ingredient in Benadryl, Unisom, Zizquil, and many other sleep aids and allergy medications, belong to a class of drugs with strong anticholinergic properties. Anticholinergic means that the drug blocks acetylcholine, which is one of the most important neurotransmitters for memory and learning. Blocking acetylcholine in a young brain might cause mild drowsiness. Blocking it repeatedly in an aging brain that is already producing less acetylcholine than it used to is an entirely different story. Research from the University of Washington followed nearly 3,000 adults over 7 years and found that people who took anticholinergic medications like diphenhydramine regularly had a significantly higher risk of developing dementia, and that the risk increased with cumulative exposure, meaning the longer and more frequently a person took these drugs, the greater the damage. What makes this especially dangerous is that many seniors take Benadryl every night as a sleep aid because it is cheap, it is easy to buy, and no one told them it was harmful to their brain. If you have an older parent or grandparent who takes Benadryl or similar products regularly, please bring this to a doctor's attention right away. The third category is bladder medications, specifically those used to treat overactive bladder, and this category is critically important because it is enormously prescribed to older adults and enormously underdiscussed in terms of its brain risks. Medications like oxybutynin, tolterodine, solifenacin, and darafenacin are given to millions of seniors to help control urinary urgency and incontinence. And yes, they do help with bladder control. But they are also powerfully anticholinergic, meaning they block acetylcholine throughout the body, including in the brain. Several major studies have found that these bladder medications are among the strongest contributors to anticholinergic cognitive burden in older adults. A landmark study published in JAMA Internal Medicine found a clear dose-response relationship between anticholinergic drug use, including bladder medications, and dementia risk, meaning the more a person used these drugs, the higher their risk climbed. One of the most damaging of these is oxybutynin, which crosses the blood-brain barrier very readily in older patients and has been shown in clinical studies to impair memory and processing speed even after just a few weeks of use. If your loved one is on a bladder medication and you have noticed changes in their thinking or memory, this is a conversation that needs to happen with their doctor. There are alternative approaches to overactive bladder that do not carry the same brain risks, and a geriatrician or urologist can help explore those. The fourth category is antidepressants, and I want to be extremely clear here because this is a nuanced topic. Depression itself is harmful to the brain, and untreated depression in older adults can absolutely contribute to cognitive decline. I am not saying that seniors should not be treated for depression. What I am saying is that certain types of antidepressants carry significant anticholinergic burden and deserve very careful consideration in older patients. tricyclic antidepressants, which are an older class of antidepressant that includes medications like amitriptyline, nortriptyline, imipramine, and doxepin, are particularly concerning. These drugs are still widely prescribed to older adults, often not even primarily for depression, but for pain, for sleep, or for nerve-related symptoms. But they are deeply anticholinergic, and study after study has linked their use in seniors to increased risk of confusion, memory problems, and dementia. Even some of the newer antidepressants, particularly paroxetine from the class known as SSRIs, carry moderate anticholinergic effects that can be meaningful in an older brain. If a senior in your life is taking an antidepressant and showing cognitive symptoms, it is worth asking a doctor whether the specific medication could be contributing and whether a lower-risk alternative is available. The fifth category is antipsychotic medications, and this one is particularly heartbreaking because it represents one of the most widespread forms of pharmaceutical harm in elderly care today. Medications like quetiapine, risperidone, haloperidol, and olanzapine are being given to hundreds of thousands of older adults in nursing homes and assisted living facilities, often not for genuine psychiatric conditions, but to sedate agitated patients and make them easier to manage. The FDA has issued black box warnings, which are the most serious type of warning the agency issues, stating that antipsychotic medications are associated with increased risk of death in elderly patients with dementia-related psychosis. But beyond the mortality risk, these drugs also accelerate cognitive decline in the very patients they are given to. They cause severe sedation, impaired balance leading to falls, and a profound dulling of mental function that can very quickly look like advanced dementia even when it is largely drug-induced. If your loved one is in a care facility and is being given an antipsychotic medication, you have the absolute right to ask why that medication was prescribed, what the alternatives are, and whether the medication can be tapered or eliminated. Advocacy in this area can be life-changing. The sixth category is blood pressure medications, particularly a group called beta blockers. Medications like metoprolol, atenolol, propranolol, and carvedilol are among the most commonly prescribed drugs in the world for heart conditions and high blood pressure. And for many people, they are essential and life-saving. But they can also cross the blood-brain barrier. And in older adults, they have been associated with fatigue, depression, slowed thinking, and in some cases, cognitive impairment that can resemble early dementia. The brain-penetrating beta blockers, especially propranolol, are the most concerning in this regard. There is also a class of blood pressure drugs called centrally acting alpha agonists, including clonidine and methyl-dopa, which work partly through the brain and can cause significant cognitive side effects in older patients, including confusion, sedation, and memory problems. Again, the message is not to stop heart medications without medical supervision, because doing so can be genuinely dangerous. The message is to be aware that cognitive changes in a senior on these medications deserve investigation, not assumption that it must be dementia. The seventh category is muscle relaxants, and this is another category where the gap between what these drugs do in a young body versus an aging body is enormous. Medications like cyclobenzaprine, methocarbamol, baclofen, and carazoprodol are commonly prescribed for muscle pain, back spasms, and injury. In older adults, these drugs cause dramatic central nervous system depression, and their effects are dramatically amplified because of slower drug metabolism and increased blood-brain barrier permeability. Seniors on muscle relaxants frequently experience confusion, impaired thinking, extreme sedation, and falls. The American Geriatric Society's Beers criteria, which is a respected guideline listing medications that are potentially inappropriate for older adults, specifically flags muscle relaxants as drugs that should generally be avoided in the elderly because their risks outweigh their benefits. The cognitive side effects can be severe enough that a senior on a muscle relaxant may appear to family members as having suddenly developed dementia. If an older person in your life was prescribed a muscle relaxant and shortly afterwards started behaving differently or seemed confused, please bring this to a doctor's attention immediately. The eighth category is corticosteroids, which are steroid medications used to treat inflammation throughout the body. Medications like prednisone, dexamethasone, and hydrocortisone are given for a vast range of conditions, including arthritis, asthma, autoimmune diseases, skin conditions, and many others. In older adults, corticosteroids can have profound effects on the brain and mental health. Short-term use can cause what is known as steroid psychosis, which involves confusion, paranoia, mood swings, and memory disruption. Long-term use can contribute to more sustained cognitive changes and has been associated with increased risk of cognitive impairment in elderly patients. The brain has receptors for corticosteroids throughout its structure, particularly in the hippocampus, and chronic elevated levels of these hormones have been shown in research to be neurotoxic, meaning they can actually damage brain cells over time. This is not a reason to panic if a senior needs a course of prednisone for a legitimate medical condition, but it is a reason to monitor carefully for any changes in thinking or behavior during and after steroid treatment, and to keep treatment duration as short as medically possible. The ninth and final category on today's list is anticholinergic drugs used to treat Parkinson's disease symptoms and nausea, specifically medications like scopolamine, promethazine, prochlorperazine, meclizine, and the older Parkinson's drug trihexyphenidyl. These drugs are among the most powerfully anticholinergic medications in existence, and in older adults they can cause immediate and severe cognitive impairment. Scopolamine patches, which are commonly used for motion sickness and nausea, and promethazine, which is given for nausea and vomiting, frequently cause acute confusion, hallucinations, and memory disruption in seniors. Meclizine, sold under brand names like Antivert and Bonine, and used for dizziness and vertigo, is similarly problematic in older patients. The experience can be so sudden and so severe that families rush their loved one to the emergency room convinced they have had a stroke, when in fact, the cause is a medication given for something as simple as nausea during a car ride. Medical professionals who work with seniors are increasingly aware of this problem, but many general practitioners and emergency room physicians still prescribe these drugs without adequate consideration of the patient's age and vulnerability. Now, let us talk about what you can actually do with all of this information, because knowing is only the first step. The second step is action. The first thing I want you to do is make a complete list of every single medication, every vitamin, every supplement, every over-the-counter drug that your older loved one takes. Bring this list to their next doctor's appointment and ask specifically, one by one, whether any of these medications has anticholinergic properties or has been associated with cognitive side effects in older adults. Ask whether the benefits of each medication still outweigh the risks given the patient's current age, kidney function, and liver function. Ask whether any of these medications can be reduced in dose, replaced with a safer alternative, or potentially eliminated altogether. This process is called a medication review or medication reconciliation, and it is something that a geriatrician, which is a doctor who specializes in the care of older adults, is specifically trained to do. If your loved one does not have a geriatrician and they are over 70, getting them evaluated by one is one of the most valuable things you can do for their long-term health. You can also ask your pharmacist for help. Pharmacists are extraordinarily knowledgeable about drug interactions and side effects, and many of them will do a comprehensive medication review at no charge. They can help you identify which drugs on a senior's list carry anticholinergic burden, whether any of the medications interact with each other in ways that could be harmful, and whether there are safer alternatives that a doctor could consider. Do not underestimate the pharmacist as a resource. They are genuinely one of the most valuable and underused members of the healthcare team. There is also a simple scoring tool that researchers have developed called the Anticholinergic Cognitive Burden Scale, or ACB scale, which assigns a numerical score to common medications based on their anticholinergic potency. A total score of 3 or more on this scale has been linked to significantly impaired cognitive function in older adults. This scale is publicly available and can help you and your doctor evaluate the cumulative anticholinergic burden a senior is carrying from all their medications combined. No single drug may seem like a problem on its own, but when you add 4 or 5 moderately anticholinergic drugs together, the total burden on the brain can be enormous. I also want to speak directly to anyone watching this who may be noticing changes in themselves. Maybe you have been more forgetful lately. Maybe you have been confused at times when you normally would not be. Maybe you have been feeling mentally slower or less sharp than usual. Before you assume the worst, before you go down the road of fear about Alzheimer's, please look at what medications you are taking. Talk to your doctor. Ask whether any of your prescriptions could be contributing to what you are experiencing. Because if it is medication-induced cognitive impairment, there is hope. There is a path forward. Tapering the right medication under medical supervision can sometimes result in cognitive recovery that is nothing short of remarkable. I have seen stories, and the medical literature is full of them, of seniors who were written off as having dementia, moved into memory care facilities, considered to be at the end of their cognitive lives, who, after a medication review and the careful discontinuation of 1 or 2 drugs, came back. Their memories returned, their personalities returned, their ability to recognize their family members returned. It does not happen in every case. Some cognitive damage from prolonged drug use may be irreversible, but the only way to know is to investigate. And that investigation starts with asking the right questions. Before I close, I also want to say something to the family members, the adult children, the spouses, the caregivers who are watching this and thinking about a loved one right now. Your role in this is more important than you might realize. Older adults are often not in a position to advocate for themselves in a medical system that is busy, overworked, and not always attuned to the specific vulnerabilities of aging. They may not realize that their medication is affecting their thinking because the medication itself is affecting their ability to perceive the change clearly. They may defer to their doctor without asking questions because their generation was raised to trust medical authority without challenge. They may be embarrassed to mention cognitive symptoms for fear of being labeled or losing independence. You are their voice. You are their advocate. Going to appointments with them, asking the questions they might not think to ask, bringing a medication list, pushing back respectfully but firmly when something does not seem right. These are acts of love that could preserve someone's mind and someone's life. The medical system is not perfect. Doctors are working with enormous time constraints, enormous patient loads, and often prescribing guidelines that do not fully account for the unique vulnerabilities of older patients. That does not mean doctors are bad or uncaring. It means that you have to be an active participant in the care of yourself or your loved one. It means that you have to be informed, and today, you are more informed than you were when you pressed play on this video. There is one more thing I want to leave you with. Many of the conditions for which these medications are prescribed, sleep problems, bladder urgency, anxiety, mild depression, pain. These are all conditions where non-pharmacological approaches have genuine evidence behind them. Cognitive behavioral therapy for insomnia, for instance, has been shown to outperform sleep medications in long-term outcomes without any of the cognitive risks. Pelvic floor physical therapy has helped many patients manage overactive bladder without medication. Exercise and mind-body practices like yoga and Tai Chi have meaningful evidence for reducing anxiety in older adults. Dietary changes, social connection, and purposeful daily activity all protect the aging brain in ways that no pill can replicate. This does not mean medication is never the right answer. It sometimes absolutely is. But it does mean that when a senior is put on a new medication, the question worth asking is always, is there a non-drug approach we have not fully explored? And when a senior is already on multiple medications and starting to show cognitive decline, the question worth asking is always, could one of these be the cause? If today's video has given you even one piece of information that you did not have before, if it has prompted you to look more carefully at a medication list, to make a doctor's appointment, to start a conversation with a pharmacist, then it has done its job. Your brain is your most precious organ. It is the seat of who you are, your memories, your relationships, your identity. It deserves to be protected with every piece of knowledge available. Please share this video with anyone in your life who is over 60 or who loves someone who is. The more people who have this information, the more minds we can protect. Thank you so much for being here. Take care of yourselves, take care of the people you love, and never stop asking questions. Because sometimes the most important question you will ever ask is whether that pill in your hand is helping your brain or quietly harming it.